Hello, everyone. Hello. Thank you for being there. Thank you for being there again. If you were connected last time, it was a technical problem that we had. So for you to know, I was speaking by myself during half an hour approximately, and I was thinking that all of you were connected there. For the new ones today, we had a technical problem last time, so we couldn't finish the presentation. And I didn't find out until I get to the final slide. So that's why we are doing it again. I assume that some of you were already connected last time. So what we are gonna be doing today is just to do an introduction of what we talked last time, because I don't want to, of course, start the topic without saying the first part, and especially if some of you were not there 2 weeks ago. So I really want you to introduce to the topic. So after the first half of the presentation, then I'm gonna go deeper to the concepts or to the topics that we are discussing there. So I just want to remember you, and also if it is the first time that you are connecting to this masterclass, that this is part of the sports nutrition master degree that we are going to be doing from the Real Madrid School and the European University of Madrid. This one is going to start in May 23 May of this year, the first edition. I am the director of the program. We have amazing teachers for you. We are going to be reviewing all the topics related to nutrition for sports, for sport performance, and also for nutrition for physical exercise. So this is one topic that is always part of a nutrition course, or it should be always a part of the nutrition course, because not only general population, also athletic population, they are trying to follow, in some cases, intermittent fasting. So as I was saying last time, 2 weeks ago, we are going to try to solve this question. What do we really know? What do we know about intermittent fasting? Always thinking from a scientific point of view, but trying to put in the topic into practice too, to decide if there are some cases where we can use this strategy, or maybe it's not a good idea for anyone. So that's something that we are going to try to solve, of course, based on what the scientific publications are telling us. As I said last time, if you want to be in contact with me, I love to do that. So there you have my Instagram account. It's just Noelia Bonfanti, and my Twitter account that is the same, but in the opposite way, Bonfanti Noelia. So I'm going to be in touch with you if you want over there by the social network. So as I was saying last time, the first thing that we need to solve is, what do we call fasting? That's something that I was explaining last time, because we don't really know how much time do we have to spend to be fasting, because some people understand fasting when they are 8 hours without eating. Another person can understand fasting when they are 16 hours without eating, and for some people it's maybe 12 hours, or some of them maybe are fasting and they don't know about it. So we don't really know, or the general population of the population don't know, what are we really calling fasting. And when we talk about intermittent fasting, and if you look into the scientific publications and also in the social network publications, some people is talking about intermittent fasting, and other people is talking about intermittent energy restriction, or maybe some restriction of some specific foods, for example, reducing carbohydrates and reducing calories during the day. But we need to define what are we really talking about. So as I was saying also last time, 2 weeks ago, we have different religions which are following fasting in different ways. So it is not the same, the kind of fasting that Christians are doing in comparison to what the Ramadan is doing, for example, or Jews are doing. So this is important for you to know, that the practice that we are doing since a lot of time ago, many time ago, but right now in our years and recently it becomes more important. Why beyond religion? Because I think explain very well what's happening in our population, right? Now we are becoming overweight and obesity population. So it seems that intermittent fasting is being used beyond religion because people is looking for a different way or for a easy way, maybe easy for some of them to reduce energy because they are facing overweight or obesity. So intermittent fasting is in a way for some people maybe the way out of the overweight that they are fighting since a long time. And of course, social network is always helping to spread the word about everything, right? And I think a couple of years ago, this topic became really important, very important. Everybody was talking about that, and a lot of people was saying that it was the best for everyone, and a lot of people were saying that you shouldn't be doing fasting at all. So that's why I think this topic is still important to talk about, and why it's so important to understand what science is saying to us to to be sure that we are using the strategy, if we can using it in the right persons at the right moment. So I explained also 2 weeks ago that we have different protocols to follow. So all of them, the ones that you are seeing at the slide, all of them are different ways to follow intermittent fasting, but it should be better known or better says as intermittent restrictive feeding, because at the end, in some of these strategies, you are not really fasting during the whole day, or you are not really fasting during a specific period of time. You are just maybe reducing significantly the energy amount that you are taking every day. For example, in the 5-2, that is one of the one that you have here in gray, in the 5 days that you can eat, 2 days that you should be fasting, the 5 days that you are eating regular or a normal diet, but the 2 days that you should be doing restriction, it is not only about fasting, it's more like doing a keto diet, because you are just taking 500 or 600 kilocalories, which is gonna reduce a lot the carbohydrates that you are taking. And since you are reducing the carbohydrates you are taking, you are doing that day a keto diet. So in a way, you are trying to mimic the ketogenic diet and the effects that the ketogenic diet is also generating in the body. Then you have, for example, different ways to do it, like 3 to 4 days fasting, which means 800 to 1,200 kilocalories for the 2 days that you are fasting, which, if you think about fasting, for example, in some religions who are not eating at all during 2 days, then there is not fasting in here, right? Because you are still eating some kilocalories that day. So this is for you to know that we should be calling it restrict feeding, which is in a way of fasting, but it's different to be fasting. And still, I cannot resolve the question about what are we calling fasting, because you can be calling fasting to different times of the day and different periods of the day. So the most famous one, or the most common one, and when the majority of the people is thinking about intermittent fasting or time restrictive feeding, but people know it better as intermittent fasting, they think about the 16-8. So that means 16 hours fasting, 8 hours, and that is the time that you can eat. This can run from 20 hours fasting and to 4 hours of intake, or even 12 hours fasting and 12 hours of intake. But at the end, we still don't know many points that need to be defined. The first one is that we have different ways to do it. So when we talk and we analyze the different results that we can get from the intermittent fasting or time restricted feeding, then it is not easy to compare, because maybe it is not the same to be doing the 16 hours fasting, 8 hours eating, than eating during 5 days, whatever you want. And then after the 5 days, you are doing a very low energetic diet, the 2 days that you are not eating as a regular diet. So the results can be completely different. So then if you compare what they are doing when they are not fasting or restricting the energy, some of the studies that we find in the scientific publications, they are following a normal caloric diet, which means that the days that we are not fasting, we need to eat the same that we are spending, or we can follow a hypercaloric diet, or it can be a hypocaloric diet, or it can be even ad libitum, which means eat whatever you want. So this is not easy to compare, because what's happening in the days that you are not following the restrictive feeding is completely different. Then all the studies use different time periods, and there is no study showing what's happening in the long term. So they cannot do follow-up for a long term. So we don't know what's happening to people after 2 years, but we also don't know if people is following this protocol after 2 years. So we don't know yet how long should each protocol be maintained, benefits, or what's happening if we are doing the same protocol during 2 years or 3 or maybe 2 weeks. So that's something that we still need to define. But the truth is, and as I showed you last time, in recent years, fasting is associated with several positive effects. So I already showed you this. It's related to the digestive system, the glycemic control, the fat loss, of course. It can be helpful in the treatment of some chronic disease, but the majority of the studies were done with rats. So if we analyze, let me do something this time. I want to make sure that we are still connected. Yes, we are still connected. So I wanted to check this time, because still, again, I don't have my phone with me. I am not a phone person, so I don't know where my phone is. So I just wanted to check that you are still online, and I am still online. So I was saying that many studies were done with rats, and when we analyze the studies that we can see done in rats, they find different positive effects, all related to the hormonal profile, the lipid profiles, even the digestive system improvements, how we can manage better the insulin release, how we can manage better the glycemia, also related to antioxidation, to appetite control. The appetite control it has a very easy explanation, because when we are restricting feeding, or when we are reducing or fasting during 16 hours, we are doing short terms of keto diet. And we know that ketogenic bodies are going to the brain, and in the brain, they are stopping the appetite in the long term, not the first days. But yes, this is happening after we get adapted to that. So then, of course, weight loss. All of these positive effects were found mainly in rats. If we analyze the studies in human beings, then we have similar benefits. Again, remember that all the studies use different methodologies and periods of time, and many of them were not using a control group, so they are not really comparing what's happening in the restrictive feeding protocol in comparison with a normal group. But the thing is that with the human being studies, the majority of the population use the samples of the studies were overweight people, obesity people, and diabetes or pre-diabetes. So that means that we cannot extrapolate yet all the results that we have from human studies to healthy population. So that's why it's so important to understand science. It's not only about reading what the studies are saying, it's also about being able to understand how I can use this with the people I am working with. Again, even in this population, there is still a lack of uniformity and controlling the methodologies to generate evidence-based recommendations. So I am not saying that we shouldn't be using it, but I am saying that we still need to do more studies to find out how to use it. But maybe, and that's something that I want to solve for you, maybe we can use it right now as a strategy in some specific person that we can resolve, or we can treat some problems and issues, and we don't have another way, or we already try another way. So I think that this one of the last slides that I was maybe still with you last time. So I was asking which could be the reason for these changes that we are seeing, especially in rats, but also in some overweight and diabetic people. So one of the first reasons could be the weight loss, of course, because we know that overweight is related to chronic disease, to a bad management of the insulin from the pancreas. It's also related to a change in the glycemia for bad. It's also related to alteration in the lipids in the blood, cholesterol, triglycerides. So at the end, if we are restricting energy, and those days that we are restricting energy, that we are following the protocol, or we are doing fasting, we are doing at the end a very hypocaloric diet. So that means that this is another way to restrict energy. If we are able to reduce weight loss, then as a consequence, we are gonna have good effects. That's one of the thinking that we usually have. Okay, then we know that similar to what's happening in keto diet, an exchange in the utilization of the energy fuels is happening. That means that we don't have enough carbohydrates. That's why we need to use more fats. So we need to use more fats, we need to use more fatty acids and more ketone bodies that the body is producing. So this exchange in the utilization of the energy can make the fatty acids that we have storage in the adipose tissue to move quickly and to reduce also more fat. As a consequence of this, fatty acids and the oxidation of the fatty acids is also increased. So that means that in the long term, we decrease postprandial lipemia, which means the lipids that we have after eating, and also triglycerides. So this at the end can improve also the insulin sensitivity from the pancreas. So we are managed better how the pancreas release the insulin. And some studies are also showing that if we regulate blood glucose, the glycemia, so if we see this in the short term, this could be one of the reasons that is helping to diabetic people, of course. But pay attention that some studies show also maybe a deterioration of glucose metabolism at the muscle mass. So maybe when we talk or we think about exercise, maybe we need to be very careful on how we use this, because maybe in the muscle the glucose is not working in the same way, and we are not giving the muscle the right fuel that we need according to the type of exercise that we are doing. So I think that there are some questions that perhaps maybe it is still too early to answer. So that's something that maybe you already saw last time, but I think these are the main questions that I would like to solve. I'm going to show you some studies, at least to show you what's happening with the positive results if we don't lose weight. So because this is going to help with the idea that intermittent fasting maybe is just helping because it's a way to reduce body fat, but maybe not. So there is one main study who tried to show us that. Then we are going to review if it is the same to restrict the food at any time of the day. So it is the same to be eating more in the first half of the day, or it is better to be eating in the second half of the day. And we are going to check side effects to see what the studies are showing, if we can have some side effects because we are doing the restrictive feeding or intermittent fasting. Then I think I cannot even show you scientific publications to solve the other questions, but I want you to have them in mind. What's happening with the adherence in the long term? What about healthy people? Because we don't have studies in healthy population. we don't know if all the type of intermittent fasting are producing the same results because we cannot compare. We don't know what happens if we maintain this in the long term. And this is something that some studies are trying to show, but we don't really know what's happening, or if we can get exactly the same results if we are exercising and following a traditional hypocaloric diet to reduce body fat. So I am not saying that we need to choose one of other. Maybe it's about choosing the one which is right for the person I have in front of me, and also taking into account the type and the amount of exercise that this person is doing during the day. So, trying to solve this question, we have the Sutton and collaborators study, who tried to solve the question doing intermittent fasting but without losing weight. So what they did was a protocol that they call early time restrictive feeding, and they were allowing people in this group to eat during 6 hours of the day, from 7 a.m. in the morning till 1 p.m. So that was the window in what they could be eating. Then 80 hours after that, they must not eat anything. So they call it like breakfast at 7 a.m., which makes sense. Lunch at 10 a.m., which maybe it's not lunch, maybe for us it's a snack. And dinner, because it was the last meal of the day, around 1 p.m. Putting this into practice would mean that we have breakfast, then we do a snack in the middle, then we have lunch, and then we don't eat until the next morning. And they compare this way of eating with a control group where people were eating during a time frame of 12 hours. But they were really focused in avoiding losing weight. So any of the group, not the time restricted feeding, not the normal group, were losing weight at all. So they were just eating exactly the same kilocalories, but in different frames of the day. What they found, that even without losing weight and even eating the same kilocalories but doing 80 hours fasting, the group doing the 80 hours fasting, they show a better insulin sensitivity, a better B cell response from the pancreas, a reduction in the oxidative stress, also a reduction in the blood pressure, but not changes in the glycemia. So this is only one study, and I always say that we cannot solve the questions with the result from one study, but this is a first study showing us that maybe the restrictive feeding of the period fasting can help even if we are not losing weight. At least can help, especially with the pancreas release, with the oxidative stress and the blood pressure, but it's not having effects in the glycemia. So, of course, if we reduce weight doing intermittent fasting, then we know that we are going to be helping the person, we are going to be helping the body because we are losing weight. But we can have maybe extra benefits because we are doing it in this way. So it is the same to restrict the intake at any time of the day. So it is the same if you are restricting the feeding in a period of 16 hours during night or during the day. The same study and other studies that you can have there in the references, they show that it is not the same, or it seems that it's going to be different if you restrict feeding during the day or during the night. So the time of the day when people is fasting can change significantly the results. What they call midday time restrict feeding is better than the late time restricted feeding, which means start eating after 4 p.m. So instead of doing breakfast, lunch, or breakfast, snack, and lunch, we change and we do like a snack, another snack, and dinner. And then we don't have breakfast the next day. So this is pretty common, for example, to to see it in Ramadan, because people doing Ramadan, they cannot eat when they have light. So they are doing this. They are eating in the dark hours. So, and this from a nutritional point of view or a health point of view is not the same. Of course, it's a religion and we cannot change that. But for you to understand or to have an idea what we are talking about. That's why maybe not all the type of fasting are good. At the end, if we look into the studies, we know for now that eating after 4 p.m. does not seem to produce any benefit, and it can even impair the glycemia, can be harmful for the glycemia, for the response of the pancreas, for the blood lipids and the blood pressure. So maybe it's not only that it's not so good as restrictive feeding in the first part of the day, but it can also be bad in some people or in some situations. So why this can be bad? It makes total sense when we think about the circadian cycle, because the circadian cycle is regulating our energy metabolism, our carbohydrates and fat metabolism, and this circadian cycle is changing the way that we release our hormones in different times of the day. So we know that in specific moments of the day, but mainly in the first part of the day, we are more sensitive to digest food and to use our comparison to what we are doing at night, especially if we are having dinner really late in the night. So at the end, everything higher or everything is more prepared to be working more during morning than during night. So that's why it makes sense to think about our restrictive feeding during the days that we have better management of our energetic fuels. Of course, this is not taking into account if we are doing exercise, because if we have people training at night, then our hormone release also changes. So that's why it's also important to think about the exercise and how we combine nutrition with exercise. But generally speaking, if people is doing exercise once per day and mainly in the morning, then it's going to be better if we do restrictive feeding eating at morning and doing the restrictive feeding through the night. At the end, and I put this in Spanish on purpose because I don't know where are you from, but in Argentina I am from, and in Spain too, I know that people say it too. La abuela de razón means grandma had right, because we know that our grandmothers are always saying that we should be eating at morning like a king, then we should be having lunch more like a princess, and then we should be having dinner like people who is not having nothing to eat. Okay, so that means that we should be concentrating more our intake at morning, midday, but we should be reducing our intake or nutritional intake at night. Again, this is a good idea if we are not thinking about training or sport performance, because when we talk about sport performance, when we talk about athletes, when I work with athletes, we work completely different. That's why we are not trying to follow intermittent fasting in athletic population. So, but for you to have in mind when we are talking maybe about overweight people or general population, it could be helpful to think about the circadian cycle, and we should need to come to make sure that we are eating in the right moments of the day if we can do it. Maybe it's not only about following a specific protocol, it's more about trying to make things better than we are doing it right now as a population. So, finally, to solve the questions that I was going to try to solve, we also need to know if the intermittent fasting can also have side effects. And when we look into the scientific publications, we found side effects, and I can think about others that maybe they were not reported because maybe they were not asked. I don't know. So we can find that some people reported migraines, fatigue, performance impairment, depression, reluctance, but no. Okay. Then from experience with my patients and with myself, because I tried many times to see what's happening, and to help with the digestive issues is very helpful. But we need to know also what's happening with the bowel habits. Because maybe for some people, this is an experience with a lot of persons. Some people is facing constipation because they are not eating for many hours in the day, and this is gonna change the signal that the brain is sending to the gut, and the gut is sending to the brain. So if we change this, we are helping some part of the body, but we are making worse another part of the body, because if we are having constipation, then this can be having inflammatory effects, and this can be changing our bacteria in the gut. So we need to make sure that people is not facing constipation because of intermittent fasting. Then we don't know what happened with the eye signals in the long term. We are really changing this because of the bodies that we have going to the brain. We don't know what's happening with the cognitive functions, because we know that the main fuel of the brain is the glucose. So if we are reducing glucose and we are using a lot of ketonic bodies, then we don't know how the brain is going to react to that. So there are still questions that we need to solve, and we need to have in mind that maybe some side effects can show. And what else do we don't know? Well, all of this. Maybe there are too many questions, but I think that we need to think about them, and we need just to have them present when we are thinking about using the strategy. So, and some of them can be even maybe improve if we do it in the right way. Because, for example, when I read the studies saying that people should be eating whatever they want the days that they are not fasting, I don't do that. So when I am working with my patients and people with who we are using this strategy, we are always trying to educate. So it is not the same to follow a protocol of restrictive feeding if you are educating how to eat, and if you are working on the eating habits of the person. So you can really improve the nutritional habits, and you can use the intermittent fasting as a strategy. But for that, you need to make sure that you know that you are educating about what to eat in the moments that the people is eating. We don't know what's happening with our biological clock, because we are saying that we should follow the circadian cycle, but then when we do type of protocols like the 5-2, in the 2 days that we are eating really low energy value, then we are also changing the hormone release. So we don't know how the body is going to react to that in the long term. This is the third one is related to the first one. So we, from my point of view, so we shouldn't be making people eat free the days that they are not fasting. We need to teach how to eat, because we want to make sure that they are not eating a lot of processed foods. They are not in deficit of micronutrients. They are not lacking proteins. Then they can be maybe losing also muscle mass. Maybe they are having an excess of monosaccharide sugars. So that's something that we need to work on. So if you really want to use this strategy, we need to do it in a proper nutritional work. Then when we talk about body weight loss, there are just few studies showing what's happening with the composition of the weight loss. So we don't know if they are maybe losing more muscle mass than fat mass. So that's something that we also need to evaluate if we are working with people and we are using the strategy. Then if we are talking about the recovery of the muscle glycogen and the muscle fibers, this can be really bad, because we are doing the opposite to what we are going to see in the master degree about the recommendation for improving performance and for improving recovery. Because if we are skipping carbohydrates and proteins for a time frame of 18 hours or 16 hours, then we are not recovering properly the glycogen, not the muscle fibers. And this cannot be good for a person who is training a lot. So in the same line with this, what happened in very active people, not even athletes. It's true that athletic population can be another population to think about what happened when people is doing a lot of exercise during the day. So how we can manage this, because maybe they need the carbohydrates while they are exercising, and we are reducing that. And what about the microbiota? Because we have bacteria in the gut, so we need to find out what's happening to the bacteria. There are studies starting to show that. Then we need to take into account what I was saying before, that we need to analyze if we are also having constipation or reducing our bowel habits, because this is going to change for worse. But we still need to move forward with this topic and to analyze what's happening with our bacteria in the gut. And then regarding exercise, I was mentioning it a lot. So if we try to solve this question, can or should people do fasting? We need to separate what is maybe people doing exercise to people who is practicing a sport. We have some studies referring to the practice of physical exercise. Some of them are done or were done in rats. So it's something that we cannot extrapolate to human bodies. And then for you to know the results of the most important ones, trying to prescribe some general recommendations, they are only talking about flexibility, elongation, walking exercise, or just 30 minutes walking or cycling by stationary bike. So they are not doing a training protocol. They are not doing a training planning. So this is helpful in people who is not active at all and they are starting to move. But then if we have already a very active person, maybe this is not a way for us to see if we can combine the exercise that they are doing with the intermittent fasting, because these protocols are way too low for people who is very active. There is one very important and very well done study from the group of John Hawley in Australia. I really recommend you to read it if you like the topic. The title of the study is A Time to Eat and a Time to Exercise. I'm gonna check again that we are there. Yes, we are. Perfect. And I see that you are asking questions, which is very nice to see. So in this protocol, what they did was to compare or to analyze what's happening when we are restricting eating in just a short this period of time, what's happening to the glucose, what's happening to the insulin, and what's happening to the free fatty acids. And then the same, but when we do exercise. I'm going to try to explain it easily. So this is what's happening every time that we are restricting feeding, and this is happening every time that we have an acute bout of exercise. So if you look what's happening here in the muscle, in the adipose tissue, in the blood, in the pancreas, in the liver, and in the gut, in the brain, then you can see that the time restricted feeding is of course improved when we are doing exercise, but we don't know what's happening, as I was saying, when we are doing time restricted feeding with the muscle mass, because we don't have yet a lot of studies showing what's happening to the muscle, especially because we are skipping proteins also in the time that we are fasting. If we look what's happening to the adipose tissue and the fat metabolism in the body, of course, we can reduce fat mass with the time-restricted eating. We don't know exactly which kind of fat mass are we reducing. We don't know if we are reducing visceral or only subcutaneous fat. But we know that if we are doing exercise, we reduce both. We have some studies showing that the circulating lipids in the long term are increasing a bit because of the time-restricted eating, which makes sense. We don't have energy, so the body is releasing fatty acid from the adipose tissue to use it as a fuel. But we know that if we are doing exercise, This is only happening if we are not providing enough glucose. But when we are providing enough glucose, then the lipids are not increasing a lot. With the management of glucose in the blood, both of them are helping. Both of them are helping the pancreas to improve the insulin sensitivity. We can reduce the accumulation of fat in the liver with exercise. We don't know what's happening with the time-restricted feeding. And we can reduce appetite doing exercise and doing time-restricted feeding. Which the study is saying that if we combine in the proper way the exercise protocol, a good exercise protocol, syncing in overweight people, and we combine in a good way exercise with the time-restricted eating, then we are going to be improving everything. Because the points that the time-restricted eating is not helping with, then the exercise is helping with that. So at the end, it would be a good idea to do the right combination between the time-restricted eating and the. Remember that we are not talking about high-performance athletes. So we are not saying that this protocol is working for people who is going to compete in Paris 2024. No, we're talking about overweight. We have to read a specific paper for high-performance athletes. In summary, I can tell you that maybe it's not the best idea to do intermittent fasting in this population because what I was saying about the recovery. Then maybe in some period of the year, depending on the competitions, or they are coming back from holidays, or they are trying to reduce fat and they are not going to be competing in a long period of time, then maybe we can do it if we combine perfectly the times of the day that they are exercising and the times of the day that they are restricted to it. But this is just for a specific case. We need to define a lot in high performance athlete, but for now, so far we could say that we know that metabolism of the athlete is completely different from the no-athletic population. Of course, we are not going to find any benefits in addition for the sport performance. This can be only another way to reduce energy if we are trying to reduce body fat, but we know that we can do that in other ways without affecting recovery. And maybe it is important to check what athletes are already doing, because I have athletes who are fasting already for 12 hours without knowing that they are doing it. It's just because they are having dinner early, at least from a Latin mind or Spanish Argentinian mind. And then they are having dinner around 7 and they are not eating until the next morning at 7 a.m. So they are already spending 12 hours without eating, and they don't know that they are already restricting feeding or doing fasting during 12 hours. If we are going to use it in not athletic population, if we are going to use it with people, as we said, combining in especially overweight people who is already active, and we want to combine the effects of the time restricted feeding with the effects of the exercise, then we need to make sure that we are doing exercise which depend on fat oxidation and not on carbohydrates oxidation, especially if we are doing the exercise in the period and the people is fasting. So if we want to do a high intensity exercise, which is going to be using carbohydrates, then maybe we need to do it in the time frame that we are eating and making sure that in that time frame we are eating carbohydrates. If we are not doing this and we are just doing any kind of exercise and especially training when we are not eating, then we are going to be stimulating a lot the gluconeogenesis, which means that we are going to be breaking down a lot of protein from the muscles to create glucose. Then we can be facing also hypoglycemia, and we are going to be having almost for sure muscle mass loss because we are not able to recover the muscle fibers. And of course, this can be related to fatigue and even overtraining depending on how we are managing. So that's why it's so important to pay special attention to the combination with training or physical exercise or physical activity, depending on the type of person we are working with. So, and just to finish, how do I answer all the questions that I was showing to you? So, and this is something every time I love this topic, and every time I have the opportunity to talk about this, I always tell the same because something that happened to me. I always talk everything with my husband, with Vicente, and since I am so fan of everything related to nutrition and exercise, and I am always explaining to him everything. And he is also an amateur athlete, so he's a cyclist, so he loved the topic, or he told me that he loved the topic. I don't know, but he did to me a lot of questions that we still don't know the answers. So the picture that you are seeing in there is because this is a typical beverage in Argentina that we drink every day. So I don't know if you know about that. It's called mate, and every time that we don't know what to say, we offer a mate. So it's a way to skip the questions and to pass to another topic. Because he was telling me a lot of questions. He was asking me a lot of questions. And we still don't know all of this. So how long should people do it to get the positive results? We don't really know. So what happens if people follow a protocol for a while and then stop doing it from one day to another? Do they lose all of the benefits? Do they regain weight if they were losing weight? This is also related with oxidation, and it's also related with anti-aging in a way, because if we are reducing the oxidation of the cells and the inflammatory process, then we can help also to avoid a bad aging. But what happens if I don't do it? So I am going to be aging bad because of that, or if I do exercise and I eat very well and I feel fine, I control my stress, and I have a very good sleep quality, which is not my case right now because I have a 4 months baby. But if you can do it and you are sleeping well, in that case, so I'm going to be aging worse. We don't know. So who should do it? All people. So is treatment or is prevention? So we don't know. And if I follow a healthy diet, I do exercise every day, my health is in perfect state, should we recommend fasting to these people? So it's something that we should be doing for everyone. So my conclusions, or maybe my reflections, are the following. See, we can use intermittent fasting as a possible strategy for the treatment of overweight and obesity, and also it's going to help with the cardiometabolic diseases that we know they are related to overweight and obesity. Always, if we do this within a process of nutritional education, and we are making sure that people is eating right, and they are having their micronutrients and their proteins, and this is integrated with a good exercise planning. We need to take into account the evolution of the subject and the person and his personality or her personality, the availability of food, the type of life, the family, the psychological characteristics, how this can affect a risk of eating disorders. And we need to be very careful when we are talking about returning to non-fasting, because maybe they don't want to do it anymore. And maybe we want to stop because we just wanted to do it for a short time to see if we could do a metabolic change. So we don't know, but we need to take care of this, and we need to make sure that we are controlling the evolution of the people who we are working with. If we want to use it as a prevention, I can say that there is still a lot to be defined. Today, from a scientific point of view, there is no evidence showing that we need to be fasting, all of us, because this is going to be better than just a healthy lifestyle. We don't know. It's up to each one. If we control it and we do it in the right way, this is not something that we are going to be recommending because it's prevention of diseases. There are other ways to prevent diseases, which is do exercise and eat healthy. And then this is my last conclusion. In many countries, we are doing it very bad. Maybe it's starting to do things right, as I was saying before. Maybe it is about to have dinner earlier and try to spend at least 12 hours fasting until the next meal, if we are not athletes. And this is something that we can start to do without having to follow any protocol, because we are going to be eating more to our circadian cycle and to our hormones release. So at the end, intermittent fasting or time restricted feeding is not the devil, not at all, but it's not the angel either. So maybe it depends on a lot of things, and mainly depends on who are we going to be doing it, or with who we are going to be doing, or who is deciding to do it, for what, which is something really important, which is the objective of doing this, how are we doing it, when and why. Because in nutrition and nutrition for related to exercise, which are always connected, personalization is the key, individualization is the key. So we are completely different one to each other, so we cannot be doing the same with everyone. So thank you very much. I hope that you enjoyed this time, that you can finish the presentation. I am happy to see that you are still connected, and I think we have some time to solve some questions if you are done and you are there. So if you want to ask more questions right now, just let me know. So you can write it in here, or you can, yes, you are writing there in YouTube, and they are sending me the questions to me. So Maria Blasquez, you have a Spanish name. But we are losing weight, fat, or muscle, or both. I think I already replied to you that question, right? What science is showing is that we are losing weight, and there are just a few studies showing how the composition of this weight is happening. I can tell you that if we don't pay enough attention to the protein intake, then we need to control a lot the muscle mass, because we can be reducing also muscle mass. But if we do it right, and we eat the right amount of proteins in the period that we are eating, and we do exercise to stimulate the muscle mass, strength training mainly, then we can be maintaining muscle mass. And then I think from Maria Blasquez, but this one is coming from Pilar Fernandez Martin. Hi, even though it is better to do intermittent fasting during the first part of the day, what would be convenient for people who work during night? Wow, very good question. From a physiological point of view, I would tell you that it's better also to avoid eating during night, because it's true that they are changing their habits, but still they are fighting with their circadian cycle. But from a practical point of view, that's going to be very difficult for them, because then they need to be sleeping, and they are eating in different moments that normal people having the typical habits. So maybe it is not these people are not the right persons to do intermittent fasting. Maybe we need to try to do it, to do a healthy nutrition, healthy exercise, and then making sure that they are having enough and they are not eating a lot at 3 a.m. or 4 a.m. Just trying to do the right meals according to the times that they have awake during the day. So I wouldn't do intermittent fasting with this kind of persons. Konstantina Keramidaki. Can start fasting. Can start fasting at 8 or that, so he will. You are replying to me to what I am saying, right? So you are saying that this person start fasting at 6 or 8, so he will. I don't know if you wanted to continue the sentence. So he can start fasting at 6. Well, that could be a good idea. This can be a very good idea if he can start fasting at 6, and he's okay without eating until the next morning, and then they have enough time during the day to eat. Because what I am more worried about is that if we want to do it in the right way, the time that he's gonna be sleeping is the time that we want him to be eating. So that's why I don't like it. But if he can be fasting from 6 to 6 a.m. in the morning until he wakes up, he starts the day around 10 o'clock or 11 o'clock, that could be a good idea. Jesus is saying the masterclass was very interesting. The topic was new for me. Happy to hear that. Happy to read that, Jesus. Do you have any more questions? Or something that you want to share with me? Some of you tried this with you. Do you do it? Maybe only 16 hours. So I want to wait just a couple of minutes to see if you have any more questions or you want to comment something else. If you are not having more questions, it's because everything is clear, which I am happy to know too. Again, I wanted to invite you to the master's degree. It's something that we are really happy to do from the university because it's the first 100% online master degree in sports nutrition that we are going to have with the experts in every topic. We are going to be reviewing hydration. We are going to be reviewing inflammation, chronobiology, taking into account, of course, the athletic population. We are going to be working with the digestive system and how to improve it in athletic population, how to train the gut. We are going to be working, of course, with recovery, injuries, treatment of injuries, supplementation. So you're going to have all the topics related to sports nutrition. Let me see. Pilar, you're saying sorry regarding my questions, even though it's better to do it in the second part of the day. What will be convenient for people? I think this one I already replied. Yes, I already replied to you what to do with people working at night. Thank you, Christian. And Constantina, you are a registered dietitian and I use it sometime with, I imagine that with some, I don't have the full sentence, but I imagine that you use it with some people. So I think it's something that we can use if we know how we are using it and with who we are using. I also use it. And I still think that it's a good strategy, but we need to manage very well what's happening with the exercise and with the evolution of the person. Okay, thank you very much to all of you. We are in touch, and I hope you can listen, check if you would like to do in the future the master degree, and of course you can reach me out in Instagram, and we can talk and discuss more if you want about intermittent fasting or everything you want. Thank you very much, and it was a pleasure for me that we could do it completely today. Bye bye.